Hi, I'm Dr. Scott Jackson. I'm a board-certified dermatologist with Ozark Dermatology. I'm originally from the New Orleans area in South Louisiana. I practiced dermatology for 12 years down there before deciding to move up here to continue my practice in Northwest Arkansas. Couldn't be more excited to be here with my family. I'm looking forward to taking care of many patients here in this community. I understand we're going to do some questions today, so I'm really excited about that. Let's get right to it. The question is whether a person should use one sunscreen for everyday use and then another sunscreen for intense sun exposure. The answer is yes. I think that it comes down to actually liking your sunscreen, and for everyday use, you want something that's light and easy to use, not particularly messy, and has you with some good coverage. We recommend an SPF 30 or higher for that circumstance. However, when you're out at the beach or doing something outdoors for an extended period of time where there's lots of sun, you might try something a lot stronger in the SPF and a little more spreadable over wider parts of the body. What exactly is a retinoid? A retinoid is a molecule that is derived from vitamin A that is applied to the skin for several purposes. The most common use of a retinoid is in the treatment of acne. So things like Retin-A and Differin and several other retinoids that we have at our disposal are commonly prescribed for acne, and their benefits is for declogging the pores and treating blackheads and whiteheads and sort of preventing acne. We also use retinoids for the purposes of anti-aging benefits, cosmetics. They've been shown to help with fine lines and wrinkles and sort of the prevention of those things. But the question is about oily skin and how to manage it in the middle of the day. You know, you got that shiny complexion in the middle of the day, lots of oil buildup. I think the easiest thing to do is to get your hands on some salicylic acid wipes, you know, that you can keep at your desk or keep in your purse. Something that you can use to sort of, in the middle of the day, just wipe that sheen off. Salicylic acid is the best ingredient for that. It's got that ability to cut through that oil better than anything else that we have. So look for a salicylic acid wipe. What's the biggest culprit for adult acne? I see a lot of adult acne, and I feel like I have a really good handle on this. My opinion, adult acne comes down to genetics, and it comes down to hormones, particularly for women. I see a lot of adult women with cystic acne, and I'm of the opinion that it's a hormonal reaction in the skin. The treatments that we have nowadays are really good at gearing towards those hormones. We have hormone blockers that we use and other types of hormonal therapies that I think are actually the most effective therapies, and I'm confident to prescribe them as first-line treatments for adult patients with acne. Can drinking too much dairy products cause acne? I think the answer is yes, honestly. I learned over the years that diet has a heavy influence in acne, although I was trained back in the 2000s to think not so much. But patients tell me these things, and I've learned over the years that diet definitely influences acne, and I actually think dairy, more so than any other type of dietary product, is a culprit in acne. It's not just the hormones that might be in your milk, it could also be the sugar load and the hormonal imbalances that ingesting dairy products can cause. We know that dairy products can promote inflammation, and that's, I think, a major cause. I've had patients tell me over the years things weird like getting rid of cheese out of their diet caused their acne to go away, or reducing certain types of dairy products made their acne better. You have to believe that there's something to this. It's getting sunny outside. Should I already be wearing sunscreen? The answer is yes. We should wear sunscreen year-round, in the summer months as well as the winter months. The UV index can be quite high in the wintertime, and so it's very important that we think about sunscreen every day. What are the signs that a mole is abnormal and should be checked out by a dermatologist? That is a very, very important question. And we use lots of criteria when we assess moles in the clinic to decide whether we should biopsy them and worry about them. The things that I tell my patients to look for are things like asymmetry, where one half of the mole is different from the other half, or an irregularity to the border, a mixture of colors. You often will see blacks and blues and browns and reds in a mole. Sometimes even white can occur. We look for a diameter greater than a pencil eraser. Larger moles are more concerning than smaller ones. We look for moles that are changing, ones that are going through some changes. Maybe they're bleeding, maybe they're itching, maybe they're growing. I think the most important tip, though, is to look for a mole that's very different from all your other moles, what I call the ugly duckling. That mole that just stands out as odd or different, maybe darker than your other moles. That's what you want to look for. How did I get into dermatology? Well, what a great question. When I first went to medical school, my inclinations was to head into a career in primary care, internal medicine. I wanted to treat the whole patient. But during my second year of medical school, I got some exposure to dermatology through a very short course in it, and I just thought it was awesome. It was visible disease, looking at it all day with your naked eye, looking at rashes, looking at different patterns, looking at different lesions, trying to diagnose them with your naked eye. I thought that was really fun and really challenging. I had a mentor, the late Dr. Lee Nesbitt down in New Orleans, who inspired me. He was a wonderful physician, and he was very influential in my career choice as well. Most doctors can tell you about someone that influenced them at a young age to lead them into a certain field. So I had a great mentor at the time as well. Couldn't be happier with my career choice. I really feel like I've made the right decision. Is scented lotion terrible for the skin? Unfortunately, the answer is yes. Scented lotions are loaded with all sorts of things that could be allergens, cause an allergic rash, or could cause irritation on your skin. So we try to advise patients to stay away from scented lotions and focus on the bland products, things that are very good and hypoallergenic for the skin. What does SPF mean, and how much of an SPF should I have in my sunscreen? Great question. SPF stands for sun protection factor, and it's basically a way of rating a sunscreen as towards its ability to block the rays and give us protection from the sun. It is based on time, so a sunscreen with a higher SPF will allow you to stay out in the sun longer without a sunburn than a sunscreen with a lower SPF. I generally tell patients to look for SPF 30 or higher. I think that's a good, easy number to remember. And the studies have shown that SPF 30 blocks a good bit of the rays and will give you a good long time out in the sun without a burn. What's the difference between psoriasis and eczema? Very good question. Psoriasis is a chronic skin disease that is caused by abnormal immune system in the skin. It's an inflammatory condition that leads to very thick, scaly plaques on the elbows, the knees, the hands, the feet, the scalp. It's associated with joint pain in about a third of patients with the condition. It's a disorder of the immune system of the skin. I tell patients that your skin is an immunologically active organ that has its own resident immune system. And in the case of psoriasis, you're dealing with some faulty signaling molecules that are being transmitted from one cell to another that ultimately lead to inflammation and then thickening up of the skin in these plaques. Psoriasis typically doesn't itch much, although patients sometimes will complain about that. On the other hand, we have eczema. Eczema is also sort of a chronic skin disease, but it comes in a variety of shapes and sizes. It's very itchy in general and can be a real pain. It is, in my opinion, associated with a couple of different issues, the main one being a tendency towards dry skin and sensitive skin. Most patients with eczema will tell you that their skin is just dry. Some of that is just genetically determined, and some of that is based off of how they treat their skin. If you take really hot showers, you're more likely to suffer with dry skin. If you don't moisturize regularly, you're going to have dry skin. If you use a central heater a lot in the wintertime, you're going to have dry skin. So eczema is sort of a rash that's brought about by dry skin and scratching it and itching a lot, and it's associated with this sort of itch-scratch cycle that a person can get into. And can be a real problem. Fortunately, in this day and age, we have a great assortment of treatments for both conditions. We have wonderful cutting-edge treatments that can really help a person with either. And so it's important to know that there is hope nowadays if you suffer with either one of those conditions. My primary care physician recommended Dupixent for my atopic dermatitis or eczema. What are your thoughts about that treatment as a dermatologist? I absolutely love Dupixent. I think it's one of the best drugs that's ever come out for dermatology. I have helped literally dozens of patients with chronic atopic dermatitis or eczema with that treatment. It is a wonder drug. It is very, very effective and very safe. I highly recommend that you consider getting on it if you have this problem. What are your areas of interest in dermatology? I have lots of interest in my field, but my favorite thing to do is look at rashes and try to evaluate what's going on, try to figure out the cause. We have lots of interesting rashes that can occur on the skin, and I like to try to figure them out and also try to clear them up. Lots of great treatments at my disposal for that. I treat a lot of psoriasis in my practice, lots of eczema, and lots of chronic skin diseases, autoimmune diseases, blistering diseases. That's the kind of stuff that I like to treat. Well, this has been so much fun. I love the questions. They were great questions and they really made me think. But I'm really excited to be here in Northwest Arkansas. Look forward to meeting as many of you as possible. Hope that you'll come see me for any type of skin problem. I like the hard stuff, but I take care of the easy stuff too. So please come see us at Ozark Dermatology. Remember to follow us on Facebook and Instagram and to subscribe to our channel.